Okay. Hello, everyone. I'm Mary Eintema. I serve as the president and CEO of World Boston, and I'm here to welcome you to today's program, Pan-African Responses to COVID-19. This program is part of our virtual citizen diplomacy series, International Engagement in a Time of Isolation, which we aim to bring you every Tuesday around this time of day. This program today, in my view, is an extraordinary example of citizen diplomacy. We'll talk with 5 different journalists about their perspectives and their lived experiences during the pandemic, live from their 5 very different countries. As you may know, the mission of World Boston is to foster engagement in international affairs and global cooperation. Citizen diplomacy, or exchange with non-official visitors, is a big part of that mission. Even though we're at home, maybe especially while we're at home, we strongly believe that while our programs may change, the mission persists. So I hope you'll check out our other virtual programs and learn more about World Boston at worldboston.org. We need your participation, and if you can help, your financial support to keep this essential mission going. So just a couple of notes about housekeeping. You're on mute right now. When we get to questions, please don't use the chat function. It won't be monitored. Please use the Q&A feature. And don't forget to mute your cell phone. So thank you for those housekeeping items that you're bearing in mind. And I'll hop off now and hand over the virtual microphone to my colleague, Sarah Sibley. She's our Vice President for Citizen Diplomacy at World Boston. Also with us today is Josh Bruno, who is our Manager for Citizen Diplomacy. Thanks very much. Sarah, back to you.
Good afternoon, everyone. As Mary said, I have the pleasure of introducing our speakers for this week's episode, a discussion of the COVID-19 situation and responses across Africa in 5 specific countries: Egypt, Malawi, Mozambique, Namibia, and Zambia. All of these speakers are alumni of an international exchange group that visited Boston just this past February, back in the old normal. World Boston typically hosts about 800 international leaders in our greater Boston community each year, designing and implementing professional exchanges for them. Understandably, these in-person programs are on hold at the moment, at least through September. The majority of our visitors come through the US State Department sponsored International Visitor Leadership Program, or IVLP for short. It is actually celebrating its 80th anniversary this year. We had the pleasure of hosting these 5 alumni in Boston a couple months ago on an IVLP Edward R. Murrow program for journalists on research and investigation. They had professional appointments with Emerson College's Department of Journalism, as well as students there, the MIT Media Center, the Harvard Nieman Foundation, WGBH, and Muckrock. While in Boston, the journalists also enjoyed experiences at the House of Blues for a global music festival, a city tour, and lunch at historic Harvard Square. I know we have a few folks online today as well from FHI 360 in Washington, D.C., and the Office of International Visitors at the U.S. State Department, who manage their overall national IVLP program. Thank you for joining us today and supporting this continued exchange with the alumni. Now I'd like to briefly introduce our 5 speakers who are giving their time in appreciation of continued international exchange, particularly during a time of isolation. From Egypt, we have Mr. Mina Nader, who is a researcher and journalist reporting on religion and society in Egypt for a range of publications, including USA Today, The Washington Times, and The National. He is an advocate for minority rights in the Egyptian university system and has worked with students to advocate for non-sectarian admissions and assessment policies at Cairo University. Mina also volunteers at the Cairo Foundation for Development and Law to provide legal aid to vulnerable women. From Malawi, we have Mr. Joseph Mwale, who is the Bureau Supervisor for Nation Publications Limited. He is also an investigative journalist who has covered the plight of the LGBTQI community, the use of youth as tools of violence in election campaigns, neglect in the health sector, and gender equality in Malawi. Joseph is also a member of the Human Rights Defenders Coalition. From Mozambique, we have Mr. Ernesto Natsumbo, who is a lecturer of journalism at Eduardo Mondlane University's School of Art and Communication. He focuses on the role of civil society in governance processes in Mozambique. His interests include transmitting research and investigation skills to young professional journalists. From Namibia, we have Ms. Charmaine Gashihewe, who is a senior reporter of the newspaper, The Namibian, focusing on the business section of the publication. She is interested in uncovering corruption in the Namibian government and the country's business sector. And from Zambia, we have Ms. Mwila Chansa, who is a senior reporter for the Zambia Daily Mail, where she has covered major court cases affecting Zambia's national security and reports on energy companies. Prior to her current position, she worked at the Post, where she reported on elections, business, and governance. As mentioned, these 5 journalists visited Emerson College during their time in Boston, twice. The second visit was for conversation with Emerson journalism students at the Paramount Theater in Boston. We are delighted that the organizer of both of those visits is joining us today as our discussion moderator, Mr. Christopher Wilson. Christopher has facilitated many IVLP group visits over recent years to Emerson College's Department of Journalism, to tour the facility, meet with students, meet with faculty and staff, and even to conduct interviews. He is a true citizen diplomat and has warmly welcomed visitors, including bringing out his own high-level barista skills to host an International Woman of Courage awardee, an investigative journalist from Montenegro. We are grateful for his time today to continue the conversation. As Christopher and our speakers discuss for the next 30 minutes, I want to remind those of you who have recently joined the call that we are keeping attendees' mics muted. There will be time for Q&A after the 30-minute discussion, so please do send any questions you have for one or all of the speakers in the Q&A box. And if you miss anything, don't worry, we will be sharing a recording on YouTube after the event concludes. In particular, we also ask that everyone please be patient with the multiple transcontinental connections here on Zoom. We may have to turn off the panelists' videos if the connection gets a little slow, and if we lose someone's connection, we will carry on the webinar. Okay, over to you now, Christopher.
Thank you, Sarah. Thank you, World Boston, for allowing me to facilitate this conversation. I'm going to do very little talking here. We want to start with a question for all 5 panelists, which is simply, what is the COVID-19 situation in your country, and what is the impact on your daily life as individuals? We'll talk more about what your experience is as journalists after that. If you could just take maybe 1 to 2 minutes to talk about your situation. We're going to go in this order. We'll go Charmaine, then Mwila, then Joseph, then Ernesto, then Mina. So 1 to 2 minutes on the COVID-19 situation. And Charmaine, if you'd like to start us off.
A good evening or good afternoon, good morning, I don't know, wherever you're finding yourself from. Thank you so much to World Boston for having me be part of this, being part of this webinar. Currently, the situation in Namibia is that we are at 34 confirmed cases of COVID-19. I think Namibia has been lauded for being one of the countries in Africa, especially, that has been able to contain the virus. Immediately when we reported our first cases of COVID-19, it was 2 Spanish nationals, but they live in Romania, and they had arrived as tourists. This was on the 13th of March. This year, and then they arrived from Spain into Namibia, and immediately when that happened, our president just decided to restrict travels from certain countries, especially countries where we believe that they are at risk, and that happened, and that actually helped contain the virus. And afterwards, the country basically, eventually we started reporting more cases up until we were, I think, at 16 cases. And then that's when they closed off the borders completely. And that has really, really helped contain the virus. So most of our cases have been travel related. most people came from South Africa. Some were returning Namibians because people wanted to return back home after, the situation was exacerbated in other countries. And so now we stand at 34. We have no deaths currently. I'm actually proud of how government managed to just keep the virus from spreading. Only today, this morning, they announced that, this morning Namibian time, they announced that we have one local transmission, or they confirmed eventually that there's one local transmission. So most of our cases are travel related. This has really, even though it's a good thing, I'm actually for the closing of the borders and so forth. But it has really affected the economy in such a way that I think today we might have lost. Sure, I'm not sure, but it depends. I'm not sure how long, but yeah, we've lost a lot of money, or the economy has lost a lot of it to the regulations in place. So we've gradually moved. Basically, they introduced stages of stage 1 to stage 4. We are currently stage 3 of lockdown, whereby they have eased the regulations, and we are hoping to move to stage 4. Means the borders usually open, but only to specific countries. But now, because we have reported a local transmission, we might not see that. Yeah, for now, I can just stop there.
Thank you, Charmaine. Thank you, Charmaine. If we could go to Muila Chansa in Zambia with her report, please.
All right. Good evening, everyone. And thank you, World Boston, for having me on this webinar to share the COVID-19 situation in Zambia. So far, we have recorded 1,382 cases of COVID-19 in Zambia, with over 45,000 tests having been done. Looking at the situation at the moment, we have a death toll of 10. And looking at the death toll, we have a lot of cases that we have reported in Zambia, but the death toll is not commensurate with the number of cases. So there's a lot of laxity from the public in observing the COVID-19 prevention guidelines. You see in places such as markets, bus stations, life is going on as normal. People are not observing social distancing. People are not masking up in public. There's a lot of laxity, and there's a myth going on in the public. Some people think that COVID-19 does not actually exist in Zambia. So it's a very big challenge to educate the masses to observe the regulations when there's these myths going on that actually the disease does not exist in Zambia. So yeah, that is the major challenge that we have in Zambia. But there's been a lot of goodwill from the private sector, both from the government and the private sector, in supporting the fight against COVID-19. There's been financial support, material support, educational support. People have invested monies in public education, whereby programs have been running on television and TV to educate people about COVID-19. And these messages have cut across all age groups. They've been transmitted in local languages. They have targeted differently abled people, like people with hearing impairments, also able to get the message about COVID-19 through these various education channels. And then it has had a great social impact on the lives of the people in Zambia. For example, churches were not congregating for quite some time when we reported the first cases of COVID-19. It is only recently that people started going to church. And you know, Zambia is a Christian nation, so church means a lot to the people. So that's one social aspect that has been greatly affected. And then schools have been closed for some time, but with the easing of regulations, pupils have now started going back to school, especially those in examination classes such as grade 7s, grade 9s, and grade 12s. And then there's also been an announcement for the phased reopening of public universities. I think for now, that is what I can share about the COVID-19 situation here in Zambia.
Thank you very much, Marila. Let's also next look at Joseph in Malawi.
Thanks very much for having me here. We had the situation declared a state of disaster by the president on March 20. That was way before we started registering our first case on April 2, 2020. But on 23rd March, then all schools were closed because then we didn't have a case at that time, and the authorities were afraid that if we continue having schools in place, it may transmit fast, assuming we get one. So from April to somewhere around May, the numbers were not that much. We were under 100. There was a bit of a confusion because in the first instance, we had the president instituting a ministerial committee to overlook the prevention of COVID. That got a lot of criticism from the general public because it was seen to be too political. So all the restrictions that are put in place were not necessarily being followed. Later on, the president succumbed to the pressure and then instituted a new committee on May 6, which is co-chaired by a doctor from the College of Medicine here in Malawi. So as of today, we have registered 564 cases with 6 confirmed deaths. Many of these cases, out of the 564, 448 international transmitters, so it means we've imported them, mainly from our citizens that are returning from South Africa, Zimbabwe, and other countries, because they can't be stopped from entering Malawi. They still have to come. So there are many people that are coming in with COVID-19, and just today we registered about 19 of those cases. We also had challenges in terms of how the response was being conducted in the first place, because for some days, health workers had to down their tools, demanding that government raises their risk allowances, and they also demanded some personal protective equipment. It was a sad situation because for a day or two, everybody working in the health sector in the hospitals did not attend to any patient. And then government had to come in quickly with the help of other partners to help deal with the situation. Currently, like today, we also had another situation. We've got one major isolation center in Planta, which is a commercial city, where health workers have again stopped attending to people that are put at the facility, are quarantined there, that tested positive to COVID-19. Because they say the government is not attending to their needs, they're not being paid their allowances and other necessities for them to enable them work efficiently. So that's the situation that we have. So we stand at 564. Yes, the schools remain closed, but one other aspect that I need to put across is that remember we had elections last year, and the courts nullified those elections. So this year we have elections next week on 23rd June. So it's a tough situation where politicians are going out there campaigning heavily. There is no social distancing. And you've seen some politicians, actually, you've heard them, go on the podium and say, I think this COVID-19 is just political because the ruling party is just afraid of the elections. So there is no social distancing. There is no putting on of masks. There is no hand washing. There is no sanitization. And the president just a few minutes ago announced that he'd be crisscrossing the country tomorrow and Thursday just to campaign, because this will be the 3rd appearance since the COVID started for him to interact with the masses. But time for campaign is going, so he still has to come out to campaign. So the challenges we have with COVID-19, the numbers are swelling, but then we have an election. So it's kind of left the country in a fix. People want to go and vote. People have COVID on the other hand. And
We may have lost Joseph.
they're thinking voting is better off, and then maybe they'll deal with COVID later, which may be catastrophic.
Thank you, Joseph, reporting from a blackout right now.
Ernesto, sure.
Ernesto, tell us what's happening in Mozambique, please.
Good evening for us, all of us. And the situation in Mozambique is not so good. Why? Because the numbers of infection of the cases of coronavirus are still increased since it was started. For example, we started by 9 people with the coronavirus, and the government announced the state of emergency. All schools and the other services were closed. They were closed, and now 3 months ago we have got 638 cases of increasing coronavirus tests, and the covered people are 162, and we've got 4 deaths during those whole periods. This is the last announcement that government made today. And we have got a lot of challenges because people are not, what Muela and Joseph said is the same in our situation, because we are not respecting the social distance. People doesn't wearing masks, and we are waiting for what the government is going to do, because they're still organizing even the market and the other service here in Mozambique. And what is the big challenge is because of our economy. The people doesn't respect this because of our economy. We haven't got a lot of transport to take people from one side to another. And because of that, the people are going in the same buses. A lot of people are carrying in the same buses and as a transport. This is what we are challenging here in Mozambique, really. But the number where is increased, really, it's in the north of Mozambique, the 2 provinces north of Mozambique, Nampula and the capital Garden. And the government closed the borders with the neighbor. We didn't open, and we are waiting for what the government is going to announce in the end of this month, because what we expected, it's in the beginning of the next month, we will open all schools and open all services. We are waiting, we are expecting it, because we are taking now 19 days of the emergency of the state. I will stop here and waiting for another opportunity. Thank you.
Thank you, Ernesto. Mina will tell us about the situation in Egypt. Go ahead, Mina.
Okay, thanks for having me. Good evening, everybody. So according to Ministry of Health, total cases is 46,289. Recovery cases from those infected with coronavirus are 12,329. Total number of deaths 1,672. Last 24 hours 1,691 new positive cases reported and 97 deaths. Situation in Egypt now is the curfew is banned daily from 8 in the evening until 4 in the morning. Shops and stores, except pharmacies and supermarkets, close at 5 p.m. There is no space for individual work in Egypt. In Egypt, the fight against COVID-19 consists of organizations, ministries, religious organizations, certainly state and civil society. And all that is issued by civil society organizations, NGOs, is subject to suspicion and rejection by the state. The state monopolized all statistics related to cases and death. I'm not working actually on COVID-19, but I work on other topics affected by the pandemic situation. And most of the sources that I have been talking to face are afraid to talk on the record. I have been talking to on the phone. Many of them speak of the record, of course, as I mentioned. 48 hours after my return from the USA, which was the 8th of March, the Egyptian Prime Minister announced the legal pursuit of anyone who publishes any news about the epidemic in Egypt without referring to the official sources and what the Ministry of Health and the Council of Ministries announced. The Supreme Council of Media Regulation, too, headed by journalist Makram Mohammed Ahmad, had warned all newspapers, audio, visual, and electronic media not to publish or broadcast rumors or news of unknown source about the coronavirus or to transfer information from social media pages without checking their authenticity. The council will take deterrent legal measures against violators, calling on all newspapers, audio, visual, and electronic media to adhere to accuracy and professionalism and to ensure the accuracy of the information and commitment to official statements issued by the relevant official authorities. Today, the Egyptian Medical Syndicate asks the public prosecutor to release the detained doctors because of their opinions regarding the epidemic of coronavirus, noting that they numbered 5 doctors. In a statement on its official page on Facebook, the union demanded the speedy release of them until the investigations are concluded, and the presence of a union representative during the investigations as an inherent right to them. The union explained that it addressed the Attorney General in this regard and sent him a detailed statement 2 days ago to the names of the arrested doctors, warning that these mentioned facts spread a state of frustration and growing fear among doctors in a difficult time in the history of our country. The number of infections among doctors with coronavirus, which the union was able to monitor, exceeded 430, while the number of martyrs of doctors was 68. The past 2 days have witnessed an increase in the number of deaths among doctors, with nearly 20 deaths recorded within 48 hours. Million of cities, the city of million people in Egypt, such as Greater Cairo, Alexandria, and Giza, have more cases of COVID-19 than other governorates. The state works harder at it. Also, the armed forces help build field hospitals and distribute masks, and that it goes beyond awareness, but sanctions are imposed on anyone who uses public transportation like the subway and does not wear a mask and follow the instructions. That's it for now.
Thank you, Mina. You already answered our next question for the rest of the panel, which is, what has your experience been as a journalist covering your government's response to the pandemic? We want to have a little bit of time for the attendees to be able to ask questions at the end. So if you could also kind of limit your answers to maybe 2 to 3 minutes, and we'll go in the same order here, starting with Charmaine. If you could tell us about your experience as a journalist right now.
Thank you, Christopher. Well, I've been one of the journalists, including my other colleagues, but I was one of the people reporting on the novel coronavirus. Like, I started reporting on it when we sort of reported the first new cases, and my experience, it's been, government has been transparent, but then you never know as well, because, for instance, new cases are reported, you hear rumors, but the government would take a bit longer to, you know, confirm cases with a journalist because they want to announce it at a certain platform. And that sort of like delays you, because sometimes you have information and you say, you know what, we want to put this on our online, we cannot wait, and then they would just deny, and then they then release this information at a press conference, and you're like, you can send a press statement, especially, you know, during the time of COVID, or you could confirm to me because I have the information on this. But also one of the experience was just the fear, like you constantly have to be out there. And I'm a new mom. Even my editor or like my boss was really concerned about me, like heavily reporting on COVID-19 and always being out there, always running around from place to place using public transport and just coming in contact with multiple people. So it was one of those things, but I saw it as a, you know, public service and being able to report on this, and also just following the cases, because I was following cases just not only in Namibia, but also like in the US. I had just arrived from the US. I was actually not subjected to quarantine. They didn't ask me to self-quarantine. And then a few days after my arrival, Namibia reports 2 new cases. It was one of those things where I was like, okay, I don't know if I have it because I'm just coming from the US, but then I still reported on it. And it really opened up my eyes to health reporting. And it comes back to the point a colleague of mine once made and said that when reporting on issues like on pandemics and epidemics and so forth, every journalist becomes a health reporter, whether you are a business journalist, whether you are a sports journalist, because it really affects everybody. And also just as a journalist, we saw how COVID-19, how the fact that the economies had to shut down completely and how that affected our work. Companies, our workplaces have started retrenching because the economy has been shut for so long. No revenues coming in. So not only is it affecting me as a new mom, as a human being reporting on it, and also just as a public service for people, but it's also affecting our livelihoods and so forth as journalists at the end of the day, trying to make this information available to everybody. But like I said earlier on, Namibia has really tried to contain this virus and kept it at bay, and just, I mean, 34 cases after our first cases were reported on 13 March. It's one of those things where you are proud of the government for, you know, like our state of emergency, for instance, is in place for like until September. And immediately when Namibia reported the cases, the president announced a state of emergency for the whole country. And then suddenly also one of our provinces, or not province, but one of our towns or one of our regions, I don't know how, yeah, one of our regions, they are on lockdown still because they've had like a few cases of local transmission, and then also they keep reporting new cases from that side. But that's it for now. I will go on once, with more questions. Thank you.
Thank you, thank you. Mwila Chansa in Zambia, if you could speak to your experience as a journalist right now.
Okay, from my perspective as a journalist, what I have observed about the COVID-19 situation in my country is that information has been very difficult for journalists that are based outside Lusaka, because information dissemination is centralized. So whenever there are new cases or in other parts of the country other than Lusaka, you still have to wait for confirmation from people that are based in Lusaka. Maybe the Minister of Health or an official from the Ministry of Health will make a press briefing and update the nation about the new cases. So as a journalist based in the periphery of the country, it's very difficult for you to write breaking news about COVID-19 because information is centralized, not decentralized. Then the other thing, I've noticed that there's been a challenge with the provision of protective clothing for journalists. That is PPE, protective equipment for journalists. So it's quite risky because people go out there in the field exposing themselves to this virus without any form of protective clothing. But of late, I've noticed there's been some donations from the private sector who've been giving things like hand sanitizers and masks to various media houses to help reduce the risk of journalists covering this pandemic. And then from the national perspective, I think the biggest challenge in Zambia has been the geographical position of the country because we don't have any access to the sea and we are surrounded by 8 other countries. And this is an import-dependent country. We produce very little. We depend on other countries like South Africa for food imports and other necessities, goods and services. As a result, our economy has been hit badly by the outbreak of COVID-19, because when truck drivers come into the country, they're expected to be quarantined for 2 weeks. So the supply of goods and services to industries such as the mining sector has been a problem. And the people that have suffered the most from this delay are the local businessmen and women, because these are the suppliers who supply goods and services to the industries. And then also containing the disease has been a challenge because you have people coming into the country from so many entry points. Like when the cases really started increasing, Nakonde, where we share a border with Tanzania, was the most affected town where the cases really increased because it's difficult to police such borders. They're very difficult to police, and as a result, people were just coming into the country and going out of the country without really strict monitoring mechanisms, and as a result, the cases kept on rising. And then apart from the PPE, the regulations to restrict some of the businesses such as bars and restaurants affected the local people badly, more than the foreign-owned businesses, because the local people are the ones that are involved in running small businesses like bars and restaurants, and in trying to promote the observance of prevention regulations, government decided to close down bars and restaurants. And so employment has been affected because some of the bar and restaurant owners had to put their workers on forced leave, while others laid them off because they had no money to pay them. That is what I can say for now.
Thank you, Mila. Joseph, in Malawi, it looks like your lights are back on. If you could tell us about your experience as a journalist covering the pandemic response.
Yeah, because I returned from the US on 9th March, probably I was the one who returned home right after fighting for 3 days. So my company then sent me on a 30 days leave because they needed to make sure that I'm fine so that when I resume work, I'm all good. So I just went back to work on May 1. So, and then they're able to provide personal protective equipment, sanitizers and stuff. But the challenge that we have is, as stated earlier on, that we are in a COVID and election period. So at any point of the day, you are supposed to go out there and actually attend some political rallies for stories. We cover stories every day for the following day's publication. So that puts the lives of journalists at risk, especially those that may not afford to have the PPEs and other amenities that may protect them from the virus. The other aspect then, in terms of my coverage, like with COVID, is been to look at the plight of the people themselves. The tourism sector, about a month ago, announced that the various companies had retrenched about 35,000 people, and this morning we published in our newspaper that this year the tourism sector was supposed to grow by 4.8%, but because of the COVID-19, it will contract by 9.9%. So it's going into negatives because then tourists are not visiting these places. So the economy is shrinking. The other aspect, I've been looking at the plight of the people themselves. Government attempted at some point to put a lockdown, but some civil society organizations, the Human Rights Defenders Coalition, and other organizations actually challenged in court because there were no real measures to cushion the people. And government announced that it would provide 35,000 kwacha to 1 million families at 760 kwacha per dollar. So you know that's not very much money. But that has not happened. So then it's been following up on what was actually promised and what is being done and what is not being done. But it's generally a tricky situation. You're always afraid to go out there. At my workplace, besides then we have to go out for campaign rallies. We're supposed to work from home. You can only go to work when there is serious need that you have to go there and work. So it's more or less like a lockdown of ourselves. So we have to be home because then that's how you protect each other. So even meetings have to be conducted through the webinars, WhatsApp groups and stuff. But the general picture is that the other challenging aspect is that the citizens themselves are not very sure if COVID is real or not. There is too much mistrust between the citizens and the government. We've seen health workers that have gone to attend to people that have confirmed positive being chased, some being threatened that will be hacked. Like in Blanta yesterday, some health workers had to be chased from a location because they went to attend to people. So that has been recurring. And then a journalist will also be afraid that if maybe I go and do the same thing, I may be looked at as an agent of state. But COVID is there. But it's also about covering it and making sure that you stay alive. That's what I would say for the moment.
Thank you, Joseph. Ernesto, if you could finish us up for this question on your experience as a journalist.
Yeah, first I have to tell you that I'm not working as a journalist. I'm a lecturer at university and I'm teaching journalism. But I'm following what is happening in the press media here in Mozambique. Following what our colleague or my colleague was saying, I have to say that the information about COVID-19, it's only provided by the government, only. That's meaning that the public media and the private media, are depending for their own one source. No one was allowed to give any information. And it's not allowed, it's prohibited to go and try to find another information than what the government provide in order to inform people. That's why what we have here in Mozambique, the information that we have, it's providing for the government, for all media. And the media are covering the press conference with the Minister of Health or the General Director of Health. And talking about the other issue that's related to the coronavirus, I have to say that our economy here in Mozambique it's very like you know that's depending. We are depending for the other countries, our neighbors, such as South Africa, who are providing the food for the shoppers. We are not close the border for that supply only. So what is, we close the border to people. We are not moving to, or we are not close the border to South Africa, and even the South African people that doesn't come here to Mozambique, but the transport of goods are in service. That's why we still have a food. What we are facing is how to buy that food, because all the services here in Mozambique, all are not 100% working. We are closing school, we are closing university, even the civil work are not going normally to work because of that rotation of work. Today, for example, we can say that 30 people who work in certain ministry going to work, and tomorrow other people are going. We have no anything more to do here as a private business and other thing else in order to have a money to buy those the food to support families. This is what we are really challenged. We didn't close to go to lockdown because of our social economy. That's it's very, very low and lack. I have to stay here. I have to stop here. So I don't know if it is necessary to answer the question that you asked me in the chat, because I was writing the answer in private. Sorry.
Oh, no, that's totally fine. That's totally fine.
Okay, thank you.
Yeah, thank you. We have time for a couple of questions. There was one for Mina Nader in Egypt, which is, what have you seen among the people of Egypt that has given you optimism for the future?
Thank you, Christopher. Well, it's a hard question. First of all, I'm always optimistic, but in the long run. My generation of Egyptian youth strives to fight the sacred ignorance of some Egyptians refusing to close mosques and churches. And they demand people to believe in science besides their religious faith. I saw them come forward to volunteer to help those in need, whether they are economically affected by the epidemic or are infected with COVID-19, despite all the difficulties, in Egypt. That's why I'm optimistic.
Thank you, Mina. That's great. We also have a question for all the panelists, which is whether you have any ideas yet when your borders might be opening. And anyone can chime in here. We might need to unmute some microphones. Muila and Joseph.
I can I can start.
Can I?
Okay, go ahead, Muila.
All right. In Zambia, we have never really closed our borders in Zambia. What we have been doing is that when people come in, they're expected to be quarantined for 14 days. That's what's been happening at the borders. And then for the airports, I think the domestic flights have started operating because they suspended operations late in March when the COVID situation began to worsen in the country. But they have slowly started resuming operations, and we expect international flights also to resume soon. It's a phased approach. The government is taking a phased approach. They're using a wait and see situation, and as things keep on improving, they gradually start reopening the country to normal operations and normal business. So for Zambia, we've never really closed our borders completely. They've been operating, except that when people come in, they were expected to be quarantined for 14 days. That's what I can
Joseph,
say.
thank you, Muila. I think, I guess we're going to Charmaine next. Charmaine, if you want to talk about the borders in Namibia.
Yeah, thank you, Christopher. Well, I'm hoping the borders stay closed because we need to contain the virus. But we were expecting the borders to close. Apologies. Sorry.
Let me take a chance. May I talk? Okay.
Okay, sorry. Okay, we are expecting the borders to open around next month, actually, the 1st of July, when we move to stage 4 of lockdown. I spoke about the 4 stages of lockdown, but because we've reported a local transmission, the government might just change their mind around, I think, towards the end of this month. They might change their mind, and then they will keep us in stage 3 of lockdown. But even if our borders were going to open, like around the 1st of July during stage 4, they would have only opened to certain countries, and they didn't mention which countries these are, but I think our borders would still remain closed to Europe and I think the US, because like they really have high numbers of the novel coronavirus. But I think to other African countries, we might still have borders open. I mean, it would be a good thing for Namibia to open its borders because we are a net importer and 70% of our imports come from South Africa. And already now during lockdown, we've not been able to get a lot of essential goods coming, or they've been delayed. And South Africa came up with new regulations that say that they will not import certain like medication to Namibia, or people need export permits because they also need to keep their stock, or they need to make sure that they have essential goods for their countries. So, well, we hope, I really do not want the borders to open just yet. I think maybe towards the end of the year, but our tourism is struggling, and really so many people who've lost their jobs are in the tourism sector. So it would be good, okay, although they are currently promoting domestic tourism, which is still, I think, a little bit stagnant. Thank you.
Thank you. And we'll let Joseph answer the question about borders, and then I'll let Ernesto finish it off.
It's quite tricky at the moment. We have 3 main borders that are not closed. The main borders, one in border in Tanzania, then the other one border in Zambia, and the other one border in Mozambique. But the airspace remains closed except for a few cases, except for those that are bringing in electro materials, and then foreign countries that would want to expatriate their citizens because of the same COVID-19 situation. The other small borders remain closed. But I think the decision to either open all of them or let them remain closed depends on the government that is coming after June 23. That will be very key, because then we'll have to start all over in terms of steps, or continue with the ones that we have. Like a few other countries, we are a landlocked country. We can't completely close our borders. It means there'll be no fuel here. We rely on construction materials for import. We import most of the construction materials, so we can't close. It means there'll be no infrastructure development. We have to import some foodstuffs again. So it's not very clear on when we will have our borders open. Suffice to say that even when these borders, the ones that are closed, some people still find a way to trek to Tanzania, for instance, using some uncharted routes to go and bring in goods. We can't have police officers patrolling all those borders. One, they're not enough, and two, they don't have enough resources, vehicles, motorbikes to patrol them. The Minister of Transport submitted recently to the Presidential Task Force on COVID-19 to maybe open up the airspace, because through aviation, the country gets a lot of money. And for them to remain closed, it means we're losing money as well. But the task force is still thinking critically about the issue. And I don't think we'll have them open very soon. But maybe after June 23, the new government or this one will have to come up with new ideas. But for now, there is no time to kill when they're open.
Great, thank you, Joseph. Ernesto, if you'd like to have the last word.
Yeah, thank you again. I have to say that we are expected to waiting for the announcement, for the president announcement when it will host in the 29th of this month. But we are expecting to open that the border will be open in the first of the next month. But all is depends what the technical commission will inform the president, because the number of infection are really increasing. But we are all hoping that we will open for the people, borders for the people in the 1st of July, because we didn't close for good transport. You know, we are closing all the borders for people immigrant. This is all closed, even for airport and the borders for the cars. But we are expecting that the president will say something in 29th, and we expect that in the 1st of July we can open all the borders. We don't know, because all the announcement about this situation is the official announcement, and not anyone else can say anything done. President, for the whole announcement and for the health situation, we are depending for the Minister of Health. Thank you.
Thank you, and thank you to all of our panelists. That's it for me. I'm going to turn this back over to Sarah to take us home.
Wonderful. Thank you, Christopher. And thank you, everyone. We have run out of time for questions now, as we want to respect everyone's time to this webinar. Thank you to all of our speakers and our moderator for taking this time to come together. It truly was an educational and deeply interesting way to spend an hour together, hearing about the experiences you're all having during this truly global event. Thank you to all of you who tuned in. We appreciate your own call to citizen diplomacy during this challenging time, and hope you will continue to tune into our virtual webinar series. As you may already know, we are running our virtual series typically weekly on Tuesdays. We will have more opportunities coming up this month before we pivot a bit this summer. Next Tuesday, we will be running our last culinary diplomacy event for a while. I saw some previous hosts and dinner diplomats on this webinar. And this will be with our former co-op who has returned to his home country of South Korea. Registration will open tomorrow on our website. Also, still this week, on the other side of programming at World Boston, we have our first virtual Chat and Chowder event on Thursday at 6 p.m. in partnership with the WGBH Forum Network. Even virtually, the spirit of Chat and Chowder persists. So we encourage everyone to bring your own chowder and beverages, and we will host a 30-minute post-chat chat. The speaker will be Dr. John Gans, who will discuss how the National Security Council transformed the American way of war. His full bio and registration are on our website. Please stay tuned for more event announcements on our social media platforms, Facebook, Twitter, and Instagram, and sign up for our newsletters to stay informed of these opportunities. If you haven't already, you can do so on our website. Your friends at World Boston wish you all to remain in good health and in good spirits. Take care.